Lung cancer is one of the most common types of cancer in the UK, and some signs can be more subtle in our daily lives. There are around 48,500 new lung cancer cases in the UK every year, according to Cancer Research UK. Most cases are caused by smoking, but non-smokers can also develop the disease. The NHS says lung cancer usually shows no signs in its early stages before common symptoms like coughing, chest infections and breathlessness can appear. It's important to be aware of lesser-known signs and seek help if you could be at risk. As reported by The Mirror, the NHS says, lung cancer mainly affects older people. It's rare in people younger than 40. More than 4 out of 10 people diagnosed with lung cancer in the UK are aged 75 and older. Although people who have never smoked can develop lung cancer, smoking is the most common cause, accounting for more than 70 out of 100 cases. This is because smoking involves regularly inhaling a number of different toxic substances. Lung cancer signs that can show up in the morning: waking up in a sweat. Sweating can be a symptom of cancer, according to Cancer Research UK, and Healthline says excessive sweating is a common symptom of the disease. These sweating episodes can lead to people with the disease waking up in the morning feeling particularly sweaty. Cancer Research UK explains, sweating can be a cancer symptom or may be due to cancer treatment. It can be very distressing. It can also be embarrassing if you are in a social situation. A hoarse voice: waking up in the morning with a hoarse voice usually means you could do with a glass of water, but the NHS says the condition is a less common symptom of lung cancer. Hoarseness is caused by irritation or injury to the vocal cords that often goes away on its own, but long episodes should be flagged to your GP, according to the Roy Castle Lung Cancer Foundation charity. Fever: people with lung cancer may sometimes have a fever, especially in the advanced stages of the disease due to an infection. It usually includes neutropenic fever, where patients have a lower than normal number of white blood cells. Fever can also be brought on by cancer causing a blockage in your body. Cough: according to the NHS, a cough that does not go away after 3 weeks and a long-standing cough that gets worse are main symptoms of lung cancer. It often starts with spasm, and according to research around 65% of people have a cough that won't go away by the time they are diagnosed. Blood in sputum: bleeding from the lungs is another common sign of lung cancer and can start at any stage of the disease. This can range from just a few bright red spots to severe bleeding that can be fatal. Lung cancer treatment: the NHS says the type of treatment you receive for lung cancer depends on several factors, including the type of lung cancer you have, non-small cell or small cell mutations on the cancer, the size and position of the cancer, how advanced your cancer is, the stage, if the condition is diagnosed early and the cancerous cells are confined to a small area, surgery to remove the cancerous cells may be recommended. If surgery is unsuitable, for example, due to a risk of complications due to your general health, radiotherapy to destroy the cancerous cells may be recommended instead. And if the cancer has spread too far for surgery or radiotherapy to be effective, chemotherapy is usually used. There are also a number of medicines known as targeted therapies. They target a specific change in or around the cancer cells that is helping them to grow. Targeted therapies cannot cure lung cancer, but they can slow its spread. Don't miss the latest news from around Scotland and beyond. Sign up to our daily